This is a Channel 9 breaking news report.
Cutting into programming for a breaking news update this afternoon.
Governor Roy Cooper is set to give an update in just a moment on the coronavirus in North Carolina. Want to listen in now.
As you know, North Carolina has new coronavirus cases in multiple counties and regions. Over the last 24 hours, the entire nation has seen organizations implement new policies in an effort to slow the spread of the virus. Although North Carolina has not seen as much widespread infection as some other states, I want to provide stronger statewide guidance now. Health experts believe that it will protect the health and safety of North Carolinians and help prevent further spread of the virus. I strongly urge all North Carolinians to follow it and take it seriously. Starting tomorrow, we advise postponing or canceling any gatherings over 100 people. That includes conferences, assemblies, sporting events, concerts, worship services, and other gatherings. We also recommend that employers and companies allow people to work from home if possible. We recommend sick people stay home, and for everyone to be vigilant about monitoring themselves and their families for symptoms. This guidance is in effect for the entire state. Dr. Mandy Cohen, the Secretary of the Department of Health and Human Services, will talk in more detail about these and other new guidelines for the state. The circumstances are constantly changing. North Carolina has more tough decisions ahead, and we will be ready to make them. We have the benefit of learning from other countries and other states about the best ways to fight this pandemic. We know that if we slow the spread of the virus now, that fewer people will become infected or become seriously ill. And we can be more effective in avoiding an overload of our hospitals and our medical system. It will save lives. We urge everyone to comply with these steps to protect the public health above all else. But I also know that people are worried about what all this means for their families, their jobs, their incomes, and their communities. By blunting the spread of the virus, our actions today aim to lessen the long-term negative effects on our economy, as well as our health. And remember, we need to take caution and care every day, every interaction, every elbow bump, every 20-second hand wash, every time you leave your home. I'd like to say thank you to our healthcare workers. Many of you work long hours in jobs that are challenging under normal circumstances. Now, in the face of this pandemic, you're on the front lines, and we are deeply grateful for your work. This is a tough time for our state, our country, and the world. But we as North Carolinians know that we are better when we work together. We have a strong team in North Carolina of health and emergency management experts that have been working on this issue. And I'm joined today by the Secretary of the Department of Health and Human Services, Dr. Mandy Cohen, our State Public Health Director, Dr. Elizabeth Tilson, our Secretary of the Department of Public Safety, Eric Hooks, and our State Director of Emergency Management, Mike Sprayberry. Lee Williamson is our sign language interpreter. I'm now going to call on Dr. Cohen to go into more details of these new guidelines and about other guidelines that we are putting in place. Dr. Cohen.
Thank you, Governor. Your actions put North Carolina in a strong position to protect the health and well-being of our state. We do not have the luxury of a wait-and-see approach when it comes to this virus. We've seen the toll it takes on a country's healthcare system and on its people, and when needed actions are slow to come. We can do better. Our goal is to slow the spread of this virus so people will get sick, fewer people will get sick, and so those that will be able to access the excellent care that our hospitals and clinicians provide. These recommendations we are making today are known methods to reduce and slow the spread of this infection. They're based on guidance from the Centers for Disease Control and Prevention, on current actions taken by other states, and on the most up-to-date epidemiologic information we have to prevent the public's health. These recommendations are for all North Carolinians across the entire state and are effective as of tomorrow. So as the governor mentioned, first, we are recommending significant changes regarding mass gatherings, community, and social events. If your event draws more than 100 people, we recommend that you cancel, postpone, or modify that event. These events include large gatherings where people are in close contact, less than 6 feet apart, things like concerts, conferences, sporting events, faith-based events, and other large gatherings. Second, teleworking. We urge employers and employees across the state to use teleworking technology to the greatest extent possible. Stagger work schedules. Consider canceling non-essential travel. Workplaces should hold larger meetings virtually to the extent possible. Additionally, employers should arrange the workspace to optimize distance between employees, ideally 6 feet apart. Employers should urge high-risk employees to stay home and urge employees to stay home when they are sick and maximize flexibility in sick leave benefits. Third, we have updated our recommendations for schools. We are not recommending preemptive school closure at this time. However, we do recommend that schools and child care centers cancel or reduce large events and gatherings, such as assemblies, field trips, limit inter-school interactions, and consider distance or e-learning in some settings. Students at high risk should implement individual plans for distance or e-learning. The closures of some schools might be necessary in specific circumstances during the course of this epidemic. School dismissals may be necessary when staff or student absenteeism impacts the school and their ability to remain open. Short-term closures may also be necessary to facilitate public health investigations or cleaning if a case is diagnosed in a student or a staff member. The good news is that children appear to be at low risk of serious infection by this virus. As I've said many times before, this situation is rapidly changing, and the recommendations about school closures could change as we learn more. We know that decisions around school closures are always difficult to make, and we're committed to working with school leaders to determine what's in the best interests of their community moving forward. As a reminder, people who are high risk, again, those are folks who are above the age of 65 with those with underlying health conditions, should stay home to the extent possible to decrease the chance of infection. Higher risk does not mean they're more likely to catch COVID-19. It means that they are at higher risk of having severe illness if they do get sick. Higher risk individuals, again, above 65, or those with underlying health conditions, including heart disease, lung disease, diabetes, or weakened immune systems, need to take extra precautions. Likewise, facilities that serve as residential establishment for high-risk persons should restrict visitors. There are exceptions, such as end of life. They're spelled out in some more detail in the guidance we're putting out today. We know that this will be hard. As Director General of the World Health Organization said when declaring COVID-19 a pandemic yesterday, we cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic. North Carolina will help lead the way. Thank you.
I'll now recognize Mike Sprayberry, the Emergency Management Director.
Thank you, Governor. As you know, on Tuesday, March the 10th, the state EOC was activated. I think this uniquely positions us as the state emergency response team to leverage all of the different agencies and associations that are part of the state emergency response team. We naturally have relationships with the teams in the National Guard, Adult Correction and Juvenile Justice, the Highway Patrol. This also gives us leverage with our partners over at education, the universities, agriculture, and it provides us with an avenue for great interagency coordination. To that end, we've been working hard and executing planning with our public health and Office of Emergency Medical Service partners. We've been ordering additional equipment as the needs come up, and we've been building products so that we can make sure that information is getting out to all of the audiences that it needs to. Last week, we activated the Joint Information Center, and a lot of information is being pushed out through the JIC. So we intend to keep up this operational tempo. We're activated right now 7 days a week, and we see that happening for the foreseeable future. Thank you, sir.
We'll now take your questions, and if you guys can wait for the mic, we appreciate it.
Can you walk us through numbers, people who've been tested, whether or not we have enough test? I don't think it's called a kit, but there are various steps. And then not only the number of people who've been tested, but those who have had their samples taken and either submitted for testing or for whatever reason not submitted for testing.
We are doing everything we possibly can to make sure that everyone who should get a test gets tested. We did not receive the material that we were promised from the CDC, so we have begun working other avenues to do everything we can to make that happen. And Dr. Cohen, I'll let you address where we are with that.
Sure. First, what I would say, and I keep reiterating how fast everything is changing, including the numbers of people we're being tested. So we'd be happy to get you the most recent. What I would say is starting tomorrow, we are going to have a dashboard on our website that is going to help track some of this on an ongoing basis for folks. We will update it once a day. Obviously, those numbers will change over the course of 24 hours. We'll update that once a day so that folks will be able to access that. So we'll get you those, the specific numbers that you want. And so we will continue to make sure that we are working to have folks get access to the tests that they need. We did release additional guidance yesterday for doctors related to who should be tested here. So doctors have the ability to order tests for folks that have a fever, have lower respiratory symptoms, and are flu negative. So that's new guidance for folks, and we are certainly seeing folks being tested all across the state.
And that's even if they've not had contact with someone believed to be positive for coronavirus?
That is correct. So yesterday we revised guidance for doctors, so they have the ability to order those tests meeting the criteria that are, again, just are symptoms of fever, lower respiratory illness, cough essentially, and negative for the flu. I will still remind folks that it is still more common for folks to be diagnosed with the flu than COVID-19, so we do want to be picking that up in our testing as well.
Could you just speak to the delta, the difference between the test equipment, apparatus, whatever that we have versus what we need or what we'd like to have, and how many people we want to test that we're unable to so far?
Sure. We've talked this week a lot about the supplies needed at our lab. And I just want to reiterate for folks, we do not feel like we are short of supply for the actual patient test, meaning if we are going to swab your nose or your throat to send these tests, we feel like we have enough supplies to make sure that folks can get the swabs that they need in those tests. Our issue and our limitation has been for supplies at our state lab. And one particular supply that we've been talking about, and it's called, we need to do what's called extraction. And our extraction supplies have been in extremely limited supply. We've been able to have enough of that supply right now that we've been sharing that we think we have the ability to test at our state lab around 700 folks. Now that is just our state lab. The good news is that there are many other partners who are beginning to test. Our academic partners, our other clinical partners, our private sector partners have come online. Certainly LabCorp being here, they're a national company, but being here in North Carolina, certainly been great partners. But Atrium is testing, Duke, UNC. And so we know that we are seeing much more testing beyond even the state lab here, which is good news, which is why we did feel like we were able to revise our criteria yesterday so that now doctors have the ability to order COVID-19 tests for patients, again, who meet the criteria of fever, lower respiratory illness, and are flu negative. Thank you.
So I heard concerts, sporting events, faith-based activities. I'm wondering specifically about courts, DMVs, and libraries from the municipality or the government side. And then in the private sector, do you have any recommendation for grocery stores where we might have large crowds?
I think we want to make rational decisions that make sure that the public health is protected, and there are distancing requirements in these guidelines, but I'll let Dr. Cohen speak more specifically to that.
Sure, thank you. So we're putting out certain guidelines today, and what I would say, again, I keep reiterating, things are moving and evolving quickly, so we hope to put out additional guidance for various types of settings, but by and large, for settings where there may be a customer relationship, we would say, again, good hand washing, wiping down surfaces that are used often. If you are sick, stay home, and encouraging our employers to exercise flexible sick leave so that folks feel like they can stay home if they are sick. So those are generally the guidance for not just our state employees that work in frontline customer service jobs, but for others as well. In terms of your request about in supermarkets and such, again, we have to think about what we're doing in terms of risk and are folks at risk. We've talked earlier in the week about folks who may be at high risk for those who might be a household contact with someone who is positive for COVID-19. So the CDC defines the highest risk as someone who lives in the same house as someone with COVID-19. They describe a medium risk as someone who is within 6 feet, and again, that's why our guidance of social distancing, they say within 6 feet for a more prolonged period of time, 10 minutes or more. They say you're at low risk if generally other situations, walking through the aisles of a grocery store, to your question, is low risk. However, we know that the virus is here in North Carolina, and we need to take individual precautions. If you are a high-risk individual, you need to use good judgment for yourself and think about what places and settings are going to be the most safe for you to protect yourself while using all good methods of hand washing and social distancing. Thank you.
Dr. Cohen, since you're already up there, you talked about you've wanted to test these people who are presenting fever, but they're negative for flu. You've wanted to do that. Those who have presented over the past several days and yet they have not been tested, what have they been told when they show up at the doctor or the health clinic?
So, as I mentioned yesterday, we put out new guidance that directs doctors to have the ability to order COVID-19 testing if their patient is positive fever, lower respiratory illness, and is flu negative. So if someone came earlier in the week before that guidance, still having those symptoms, what I would encourage folks to do is call your doctors, anyone having those kinds of symptoms, call before you go so you can arrange how that doctor's office may want to be handling isolation precautions as they do those kinds of testing, and then go from there.
But were they directed even prior to what you're talking about now if they showed up? Because for several days it sounded like you wanted to go down this road. Or were they just, sorry, you can't be tested now, we're just sending you home? Were they told to isolate? Were they told to self-quarantine?
So earlier on, when we felt we had more limited testing capacity, we did want to focus based on the CDC criteria of someone who had a known contact with someone who was positive for COVID-19 or had a travel related potential exposure. But those guidance changed yesterday. So again, doctors have the ability now to test again if someone is showing the symptoms of COVID-19 and is not found to be positive for the flu.
I'm sorry, just along the same lines, earlier in the briefing, there were some numbers about those being monitored, those who had contact and those who were travelers. Mm-hmm. Were they tested, or did they not meet the criteria to be tested? What does that mean they're being monitored?
They were being monitored, meaning that they were having no symptoms, no fever, no cough. But we were checking in with them, and by we, I mean our local public health departments were checking in with folks who may have had a known travel exposure to make sure that they didn't develop symptoms. If they did, then they would move up into this to further evaluation as needed. But the folks we were monitoring at home are folks that are well, no symptoms, and again, we're just making sure we're keeping eyes on folks as we go forward. Thank you.
I have a few questions related to the new recommendations. I understand they don't go into effect until tomorrow, but we have a big concert in Raleigh tonight. I'm sure there's some other events going on. Are you still urging them to go forward with those events, or would you advise against that at this point?
We know that people need a heads up to begin making these decisions, and this is why we gave it until tomorrow, and our guidance begins tomorrow. They can make individual decisions about what they want to do, but our guidance begins tomorrow.
And why are these recommendations and guidance and not mandates at this point?
Well, we expect people to abide by this guidance. If we see that that is not happening, then we do have the ability to make it an order. We believe that the people of North Carolina are going to cooperate. We also know that the circumstances have been changing frequently, and that we may need to update this guidance in some way, whether upgrading or downgrading. And so we'd like to make sure that everybody's on board with this and paying attention to it. And we believe the people of North Carolina, the businesses of North Carolina, will abide by this guidance.
And then one last question. Different states across the country have been doing similar actions to this today, but have arrived at different numbers. How did you all arrive at 100 as being the number to cut off?
When we make these decisions, we are relying on our health experts, on experts at the CDC, and we're relying on their recommendations based on the health and welfare of the citizens. I think with this new coronavirus, the COVID-19, we are in somewhat uncharted territory because there are some things that we don't know. And health professionals in different places could come to different conclusions. I do know that we are looking at what other states are doing. We are talking to other states. We are sharing with each other to make sure that we are learning from each other so that we can make these decisions as we go forward. There's also different circumstances in different states. You have some states with community spread. We don't have that yet, but we expect it to come. And one of the reasons why we're doing this now is to try to prevent that as much as possible.
I just have a quick question about monitoring the people who are self-quarantining. How exactly are you doing that? Are there authorities checking on these people, or are they allowed to move about?
Dr. Cohen, I'll let you.
Yes,
Thank you. That is the work being done by our local public health departments. They are doing twice-a-day checks on folks where they check in and ask them about the status of their symptoms. Most of these are done voluntarily. When we see someone turn into a positive, the local health departments have been exercising their local public health authority to do formal isolation and use some of that authority. But generally, for the folks who have no symptoms and are self-quarantining and getting the regular checks by our local health department, we've just been using guidance, and folks have been incredibly cooperative. I think they know how serious this has been.
And Dr. Cohen, I know you said no preemptive closures of schools at this time. Can you speak more directly to the populations that do not need to worry about the coronavirus?
Well, I think what you're hearing from us today is that this is a virus we all need to take very seriously. I think we're taking important steps forward to protect our state and health. The reason that we are not currently recommending preemptive school closure is that we feel like we want to better understand as things move forward here. The good news is that the virus seems to have less of an impact in kids, meaning less severity, which is very good news. There may be times where closing a school is necessary, as I mentioned in my remarks, either to clean or to do a public health investigation. And so we want to be working closely with individual school systems as they work through what's right for their community. But right now, we want to make sure that we are using the best we can and looking at the science. The data here is really challenging. But there are real impacts if you close schools, as folks know. Not only are we worried about kids being in other settings, right? You close schools, kids still congregate in other settings, or they could be home with grandma and grandpa who are at high risk. Those are certainly an impact. And obviously, it was mentioned during our task force this morning as we had this discussion, right, there are a lot of kids that rely on free and reduced lunch and as well as breakfast. And those are all significant things that contribute to children's health. And we want to make sure we're thinking about that as a holistic package, and we'll continue to do that and be in close coordination with our education partners.
I only have one more question. Governor, you mentioned this is a tough time for our state and our country, but we would really like to hear from you about what has encouraged you over the last several days. There are a lot of moving parts, but what is something that you can tell us that's working right now?
I know that we are making progress on making sure tests are widely available, and we're going to keep working at that until we fix it. I'm also amazed at the healthcare professionals that I've talked to all over the state who are ready for this and who understand that they put themselves at risk when they are out there talking with and treating patients. And just to see their determined faces, that they are ready to deal with this and ready to coordinate with our emergency management and the people in the Emergency Operations Center to make sure that North Carolina gets through this, that is encouraging. And I believe we will get through this, and what we want to do is to take bold action now to help save the health of North Carolinians and the long-term health of our economy as well.
So are there any people waiting to be tested at this point? Do we have any people in the queue, or has everyone that needed to get tested been tested?
We want to make sure that everybody who should get tested gets tested, and now people can go to their doctors or healthcare professionals and be swabbed and send the test in to wherever the doctor wants to send it, to LabCorp, one of the other labs, to our state lab. And so we are working now doing those tests, and with the question earlier, if someone had a situation where they didn't fit the criteria earlier in the week, they could very well fit the criteria now. We do want to remind people that if you believe that you have this, to call your healthcare provider first to let them know that you're sick, so that they can advise you on the phone the best way to to get this testing done. We want people to get tested, and we're continuing to work hard to make sure those tests are available for people.
So the federal government is going to be sending money to North Carolina. I understand it's about $13.8 million. Yeah. Do we have a sense as to how that's going to be distributed? Like who's going to be getting what?
Yeah.
Do you have that yet?
Well, we are not only looking toward the federal government for help with first making sure that cost is not a barrier to get tested or to get treated, but also to needed equipment that we might have, needed additional personnel. But we also believe that we may have some requests for our own state legislature, and I will look forward to working with legislative leaders. We also know that some people are going to be hurt by this economically, that a lot of families who may be hourly workers who will be hurt by the fact that these mass gatherings have been curtailed. We want to find every way we can to help those people. We want to try to expand access to unemployment benefits, and we're looking at all of the legal avenues that we have to be able to do that, to help people. We want small businesses to be able to get help. So federal and state aid, the good thing is that I believe people are pulling together and that we can find ways to help people who are being hurt by this, not only with their health and the potential illness that they might face, but also the economic loss of the steps that we're having to take to try and prevent the spread of the virus. And we're going to make that a priority as well.
I understand that Governor Kemp in Georgia has appropriated or worked with their legislature to appropriate $100 million. Like what kind of number are you looking at with our legislature?
We're preparing those recommendations now. We know that we're going to need both state and federal assistance to do this, and we're going to work with them to see what the right number is, but we know it's going to be substantial to get everything done we need to do.
And I'm just curious, like, do we have a sense as to what the hospital capacity would be for serious folks who would need to be admitted? Right now, we don't have anyone admitted that I understand. But what would our capacity be?
We've been talking to our hospitals, and they obviously are concerned about this, but they are getting on the ready. And Dr. Cohen, I might let you address that as well.
Thank you. Yes, we are preparing for the potential need to expand capacity at our hospitals. Today, we're going to be issuing some waivers that allow for additional bed capacity at our hospitals, as well as them to move around where those beds are located, again, to respond to the virus as needed as we go forward here. Again, that will be something temporary just during this emergency situation. So we're looking for all the flexibilities that we can give folks, and we're going to be preparing to exercise those. And I appreciate all the work I know is coming that our hospitals are preparing for right now.
I don't know if this would be for Dr. Cohen, but in terms of the presumed positives, are any of those individuals in the high-risk category? And in terms of what you have seen so far, this whole notion that 80% are going to be okay, we've heard most people are at home doing well. What can you tell me in that regard?
Thank you. I, again, want to emphasize things are rapidly changing, but so far, the folks that we have seen have all been at home and haven't needed higher levels of hospitalized care at this time. But we are obviously being vigilant to make sure that we are preparing ourselves in the case that we see things escalating like we do see in New York and Washington or other. But we have so far seen a burden of illness that has allowed folks to just stay at home, which is good news. And some of those folks have been in the high-risk category by age. I don't know all of their medical history, but at least by age, we have had some folks who are above 65 and have continued to be at home. Now, they don't feel well, but they are able to be at home and recover. Thank you.
Guys, we got to get back to work, and we will have our public information people to answer any further questions, but we'll be back as well. Thank you.
Everyone, you've been listening in to that update from North Carolina Governor Roy Cooper and representatives from the North Carolina Department of Health and Human Services issuing some new guidance they say should take effect tomorrow, but they are issuing this today to let people know they want us to do things like avoid or cancel or postpone or modify any event that might have people gathering of more than 100 people. They're talking about concerts, conferences, faith-based events, and so asking people, giving out a list of things to take precautions.
And the things they mentioned specifically are where I think like you would have people sitting next to each other in a row.
They mentioned 6 feet distance.
6 foot distance. They did not say anything about church services, and many churches in our area do have more than 100 congregants. I thought about that as soon as they mentioned it, if churches are now going to look at that, because the governor said, while this is a recommendation, a guidance, they said, is there going to be enforcement of this? And he said, well, I expect people in North Carolina to abide by this, but we could do an enforcement action. And I wonder if they would do an enforcement action against a church. Or they talked about, private industry, but I didn't hear a lot about how the government is going to change. Someone asked about courts and people sitting, in the DMV and things like that, and we didn't really get an answer. There's just a lot about how private industry had to make changes, but that certainly will be a question, because many gatherings have more than 100 people, and are people going to cancel that or not? Is it up to you, or is it something that's guidance, or would they enforce it? Would they even know about it? But that was kind of the gist of what we heard there today, is that they're just seeing this as people being close together is just too risky right now.
Right, and they did mention again that 100 number, but we talked about schools specifically.
You and I both said children, there's hundreds of them.
Our children are in schools, and that is obviously a place where more than 100 people are together. But again, they announced in this that they are not recommending that there be any preemptive cancellation of schools at this time. They just mentioned any event like a school game or assembly, avoiding those types of things and rescheduling, postponing and modifying. They said faith-based events, but did not mention church services coming up this Sunday. So again, asking people to kind of take their own responsibility with this, asking companies to allow workers to telecommute or work virtually. So again, saying they believe that people in our state will act responsibly and take action on these things they're recommending.
But did leave open to, if say a child's parent has coronavirus, well, that child has been at school. They said a situation like that, they could maybe close the school for a couple of days and maybe do a cleaning of the school. As we know, this is evolving by the moment, and we could hear something different tomorrow about this as things evolve, but that's the latest there right now. And certainly I want to let you know we're going to stay on the air right up until 5 o'clock, because we have a lot of breaking developments that have happened just while that press conference was happening.
Absolutely. We have our sports anchor Matt Harris here, because as we were listening to North Carolina governor and those health officials making that announcement, you're sitting right beside us, and we're seeing moment by moment information coming in the sports world too.
Yeah, that's right. NCAA President Mark Emmert he went ahead and canceled not only March Madness for both men's and women's basketball tournaments, but also spring championships as well. So the College Baseball World Series will not be played. So Mark Emmert and the NCAA deciding to cancel both winter and spring championships. And really, that's just the latest domino to fall, as we've seen really within the last 24 hours, the sports world kind of coming together and making decisions. It started with the NBA. Rudy Gobert with the Utah Jazz, the first player to test positive for the coronavirus, and the NBA deciding to suspend their season. We want to make it clear there are postponements and then there are cancellations. They have canceled March Madness.
It just is not going to happen.
Right, in the NCAA tournament. But you look at the North Carolina High School Athletic Association, 4 local teams were set to play Saturday in either Chapel Hill or Raleigh. Newton Conover girls, Shelby boys, the Vance girls, and the North Meck boys were set to play. They have postponed the North Carolina High School Athletic Association state championships. So there's hope within that circle that give it some time and then we will reassess as time goes on. But from the professional sports franchises, NBA suspending play, NHL pausing their season. Major League Baseball has decided to suspend play for spring training and delay the start of their season by 2 weeks. The AHL, which the Charlotte Checkers play in, they were set to have a 2-game stand this weekend at Bojangles Coliseum. That has been canceled because the AHL is suspending play for their season. So right now, a lot of, we're waiting to see how the dust is going to settle. Some franchises, leagues deciding to cancel, others saying we're going to postpone and see how it plays out.
March Madness, you couldn't postpone it because they've got all these different venues lined up for specific weekends. You couldn't play it a month later because there could be a monster truck series going on in that location. But at the NBA teams or something like that, they have their dedicated stadiums, and we'll hope at some point they'll be able to continue to play.
Right.
So again, looking at all of this as a form of that social distancing that they're recommending, and that is, putting distance separation between you and other people, especially large crowds, hoping that this will slow the spread of this virus, because again, they do not want our hospitals, our emergency workers to be inundated with a high number of people experiencing this virus. And so all these actions being put in place to try to address what is the pandemic that we're facing right now.
The PGA said that no fans, but they're going to continue to have tournaments.
Right, and the Wells Fargo Championship will be played in April, so they haven't made a decision yet because that's still far enough out where they haven't said that fans will not be allowed at the Wells Fargo Championship. The PGA Tour has only made a decision within the next 30 days, so the PGA Tour is another example of a professional sports league that is waiting to see how this plays out, and over the next 30 days what could happen.
But that's not just disappointment of golf fans at the not being able to go. I mean, there are many people who rely on that for jobs for a week every spring who will not be there if there are no fans there. Of course, there's an economic trickle down, and you're out there, you see it. That's a big deal. You're talking about tens of thousands of people who are out there every day.
Right, and we heard Dallas Mavericks owner Mark Cuban last night when news started to circulate about the NBA suspending its season. One of the first things he said was, we have hourly employees and we're going to set up a program to ensure that we find some way to help them pay their bills and put food on the table, because there are people outside of just the athletes and coaches and personnel affected who rely on money coming in to provide for their families.
Yeah, this has an impact all the way around, and I know you'll keep us updated on the information coming in the sports world. Thank you, Matt.
We do have more breaking news. Just in the past 30 minutes, South Carolina Senator Lindsey Graham saying he has decided to self-quarantine. He's waiting on coronavirus test results.
Yes, he's saying that he was at Mar-a-Lago last weekend when the president of Brazil was there. Brazil's president, of course, we're all hearing, has tested positive, as well as his spokesperson. So again, Lindsey Graham understanding, recognizing that he has come into contact with someone and then taking that step to self-quarantine.
We want to head now to our Damani Lewis, who's in the studio trying to put perspective on the numbers we have both locally around America and around the world. And of course, Damani, the numbers are changing really by the hour, but you're looking at what the current numbers are.
Yeah, rapidly changing, Scott and Erica. I want you to take a good look here. We're looking at this website of Johns Hopkins University and Medicine, and they are basically accumulating all the numbers across the world of people, those impacted and affected by the coronavirus. Let's break this down, okay? So worldwide here, keep that in mind. We have 127,000 people, maybe 178,000 people that are impacted, that have been affected by this, right? So if we break that down even further, right, of that 127,000, take a look at this number right here in green. 68,000 people have already recovered. And worldwide, folks, 4,718 total deaths. Now, again, this number is fluctuating, so keep that in mind. But let's bring it a little bit closer here. Now, let's break it down to just China, right? China was, let's just say, ground zero for the coronavirus. Now, we go in a little bit here. China, 62,000 people already have recovered. You see here, total confirmed cases in China, 80,000 folks were infected by this virus. Now, if you break that down even further, in China, 3,000, just 3,000 people have died. Obviously, you don't want one death, but you see the number here. And keep in mind here, China has a population of about 1.3 billion people here. Now, let's bring it closer to home here. Let's go to the U.S. here to put it into perspective and what we're dealing with. All right, let's go. You can see in the U.S., 1,323 infected people here in the U.S., or confirmed cases in the U.S. Now, if you break that down even further, this is across the country, folks. You know, in the United States, 320 million people, right? Across the country, we're dealing with 38 deaths right now, and we're told right here 8 total recovered, and they're breaking down exactly the numbers here. So you have to keep these numbers into perspective here. And if we come to North Carolina, again, these numbers are changing. Let's go to North Carolina here. See if we can click that up. And it says right here, 9 confirmed cases. Now we know those numbers are changing, but here's the most important part right here, 0 deaths. So just to show you that these numbers are changing, but it gives you a little bit of perspective here. Let's go to another state. Let's go to the state of Washington here. If we can pull it up here, let's see here. Now, Washington was probably one of the first states that really saw, you know, the first blunt of this virus here in the U.S. So if we go to the state of Washington here, 373 confirmed cases of people infected with the coronavirus. Now, out of those 373, you have 30 deaths. Now, keep in mind, out of those 30 deaths, about 14 or 15 of those deaths came from one assisted living facility in Seattle, right outside of Seattle. So the numbers relatively small here, considering for the entire state here and obviously the entire country. And just to say, just for the entire world. But these numbers hopefully provide a little bit of perspective for what we're seeing here. Let's turn it back to you guys.
All right, Damani, thank you for sharing that. Going into detail, that site from Johns Hopkins, kind of considered by many to be kind of in the forefront of all the updates. We just came out of that update from North Carolina Governor Roy Cooper, and during that, representatives from the North Carolina Department of Health and Human Services announced that starting tomorrow, they will have on their site a dashboard that gives you even more focus specifically on North Carolina, and they say they will be updating that dashboard at least once a day.
Damani was talking about the numbers over there, which are in flux. Just really quickly, I want to remind you of what we have locally. We're hearing about 2 presumptive positive tests for people in Mecklenburg County. Again, one in Cabarrus County, and we had that one from Lancaster yesterday. But we heard state officials there talking about how they just don't have the tests to test everyone they want. I think she said they have the ability to test 700 people at their state lab. They can swab anyone. That's how they test, like the flu. They swab your nose. They can do a swab on anyone, but it's sending it off to a lab to get it tested. So the question is, we know how many people have tested positive, but what's the real number? How many people have not been able to be tested? Is the number twice what we've been reported? Is it 10 times? And that's what the testing will show us. It's just going to take a while to get caught up, because we've got, you know, LabCorp and other labs helping out the state, and it's going to take private industry working with government, I think, just to ramp up the tests and be able to get a firm number. Could take months. Yes,
there's a lot of unknowns as we are proceeding through this, and as everyone is saying, you know, it's going to take, you know, individuals taking personal responsibility and doing what we can, and then also our health and state and government officials working on that as well. As we saw last night with the address from President Trump, he gave a live address. Leaders in Washington scrambling right now with looking at more ways to stop the spread of this coronavirus in the U.S. and also to treat all the patients who are now testing positive.
A big headline last night, the president banning travel from Europe to the U.S. Just so you know, that does not apply to Americans, but Americans would have to be tested to make that travel. We have our Samantha Manning joining us live in Washington. Samantha, I see today the federal government throwing a lot of money at Wall Street, trying to calm down the markets, but then regular folks are also wondering, what can Congress do for us? And wondering if you have any insight into if the gridlock can be broken and something can happen in Washington.
Right, so a lot of the focus in Congress right now has been trying to pass a major relief package, but there's a lot of disagreement on what that should look like, right, about what it should entail. Tonight, House Democrats are still expecting to, and they're hoping to pass their version. It includes things like paid sick leave for employees who have either been sick and had to stay home or have had to stay home because their workplace has been forced to close because of the public health emergency. It also includes things like free testing for the coronavirus and increased funding for food security programs. But there have been Republicans who have been pushing back on that. They've been questioning about how we would pay for that. They've been saying that they want things like tax relief for the businesses so they can be able to cover paid sick leave. In fact, next week, it was supposed to be recess for the senators, but Senate Majority Leader Mitch McConnell had canceled that recess. So instead, senators are going to be here in Washington, and they're going to be working on coming up with their own draft legislation for combating the coronavirus right now.
You know, a lot of what we heard is that, you know, there was this impeachment, and Donald Trump, the President Trump and Nancy Pelosi maybe don't have the best relationship right now. And how can they work together? You hear people saying we need to put the politics aside and work together, but in Washington, as I'm sure you see every day, not always easy to do.
Sure, and there has been a lot of criticism of the Trump administration by Democrats. We've heard from House Speaker Nancy Pelosi, from Chuck Schumer, criticizing the president's response, saying that they've been downplaying it, that they should have been doing more. But we've also been hearing from lawmakers really on both sides saying that now is the time to come up with a bipartisan solution, kind of finding that common ground. We just talked about paid sick leave. That is something that lawmakers on both sides do agree it has to come in some kind of form, whether it's emergency relief or whether it's permanent for employees. That is some common ground. Even the president has said that he would support that in some kind of way. So it's not going to be easy, as you said. A lot of the times we see these lawmakers unable to come to some sort of a compromise, but we are hearing that they do want to come up with something soon. We're seeing a lot of economic fallout because of what's happened with the coronavirus, and something does have to happen soon.
All right, Samantha, thank you for that live update for us from our D.C. Bureau. We'll be checking in with you, of course, throughout the afternoon. And again, as she was talking about on the political scene, coronavirus, as we've seen, it does not know political party. It doesn't distinguish between socioeconomic class, what part of the country you're in. This is something that can impact everyone, all of us.
That's right. And if to have a response, some people are going to have to just give in and say there's something about this proposal I don't like, but both sides need to give up a little bit. And if neither side's happy, then maybe it's a good deal. Want to let you know that in the last 5 minutes, we've heard Lancaster County now has 2 presumptive cases. So that's 5 total in our area. Again, 2 in Meck, 2 in Lancaster, and 1 in Cabarrus. And you know, there's going to come a time where we won't be able to update these numbers because it's just going to be moving that quickly. And the number 5 will probably look like a small amount, certainly.
Well, on the bright side today.
Literally.
Yes, literally. Our chief meteorologist, Steve Butelson, you know, he has a ray of sunshine to tell you about, right, Steve?
Yeah, trying, guys, but even the clouds have returned. This over Charlotte, low to mid 70s. That was the bright news. Chesterfield, for the first time this season, we have seen an 80-degree temperature. Incredible that it's only mid-March and we're already that warm. Couple of very light showers right now falling out over York County, not far from Rock Hill, the Fort Mill area. Going to put a track on that. They're not really moving all that fast, only about 10 or so miles an hour. So they're going to be moving on toward Rock Hill in the next few minutes. Tega Cay about 5:15, on toward Leslie and Springfield a little bit after that. Also some showers out across the high country. I'll take it with our latest futurecast. Later on this evening, we'll keep an eye on some showers in the mountains into the metro. We've got a cold front coming our way. You know how unusually warm it's been. In the far upper left-hand corner of the picture, you see that band of rain. That's what we'll watch move through while we sleep tonight. First into the mountains and into the metro about the time we get up very early tomorrow morning before it begins to settle on down to the south. We're keeping an eye on some pretty potent storms. In fact, there are actually tornado watches up over portions of Kentucky and Tennessee. I don't anticipate severe weather here, but we will see some of this rain as the cold front pushes in. I'll be timing it out right through the weekend coming up in a little bit.
Hopefully you did get out and see some of that sunshine
earlier
today.
I certainly hope you got outside today. I want to get back to a coronavirus effect here in Charlotte. Wells Fargo has said that one of their Charlotte workers has been in prolonged close contact with someone who did test positive for coronavirus. That worker works on the 6th floor at One Wells Fargo Inn uptown. And this is a picture somebody took of some of the cleaning that happened on that floor last night. And you can see this looks serious and intense. No chances taken here by the cleaning crew. That employee is home. They have not tested positive for coronavirus, but because of that close contact with someone who does have it, they're just being watched closely. Other employees who've been around them have been asked to work from home at this point as well. Also, this is a huge story. This is rare. Disney said it will close Disneyland in California starting Saturday all the way through the end of the month.
Yeah, they're keeping the hotels there open until Monday. That way people can make their travel arrangements. No cases of coronavirus at this time linked to the park, but just out of caution, they say this move is out of an abundance of caution. They're taking this step.
Disney has been closing over in the east where where coronavirus first hit, but in America, Disneyland has only closed a handful of times in history. Incredibly rare.
The Whitewater Center's Green River Revival event has just been canceled, as well as the 20th annual St. Patrick's Day pub crawl in Uptown has been postponed. Thousands of people were expected for the bar car event. The organizers now say they'll move it to June the 27th, so postponed, delayed. Tonight and tomorrow's prepay events at Whiskey River are also postponed. Organizers plan to announce new dates for those within the coming weeks. And you can also email the organizers if you would like a refund instead.
All right, again, Eyewitness News at 5 is coming up. As we said, 2 cases now in Mecklenburg County, 2 presumptive cases in Lancaster and 1 in Cabarrus. We have got our reporters really just all over this story, which is affecting so many people, not just from a health standpoint, but the economic standpoint. And again, talk about, as Steve was telling us, that was it Cobb County in Atlanta, Steve?
Right.
2 weeks shutting down their schools. Could something like that happen here? Atlanta certainly thinks that's a wise thing to do. And these are questions we've been asking CMS for a while.
That's right. We're going to have a lot of answers for you and take a look at all the aspects that we're checking on for you coming up on Eyewitness News at 5. And we're going to join you with that in just a moment.
This has been a Channel 9 breaking news report. We now return to regularly scheduled programming.